I've been asked to talk to you today about a report we published last summer on the health economics of kidney disease. And this was something we've wanted to do for a while because we were very conscious that the last report on the burden of kidney disease had been published in 2012 on 2010 data, so it was really quite old. And we knew that the burden had obviously grown over that time. And we're really keen, one of our priorities as a charity is to try and get kidney disease up the agenda, both in terms of government and within the NHS, and make it more of a priority. And in order to do that, you need to have the evidence. So governments will only listen to you if you have the evidence that something's a problem. And we didn't really have, we felt, strong enough evidence. So we commissioned this report, worked with a company called ZS, who are health economists. And this slide really shows sort of the main areas that we wanted to cover within the report. So we wanted an up-to-date data on incidence and prevalence of acute kidney disease, CKD, and end-stage kidney disease. We wanted the economic burden, both on the NHS and the UK economy overall. And we wanted that burden projected forward 10 years to 2033 to see what that might look like. And also to model some interventions, some healthcare interventions, to see if we could sort of change those future predictions. And we're grateful to the companies listed on the slide for their financial support towards the report. So we wanted to involve stakeholders in this project. It was a big project, and we wanted to involve as many people really as we could who had an interest in this area. So we put together a wider team of 30 stakeholders, and I'll show you on the next slide who some of those people were. And then a steering group of 10 people who met regularly, really to sort of check on progress, to challenge some of the findings that were coming out, a bit of a sense check really on what ZS were coming up with. And then as part of the project, ZS looked through over 11,000 articles over the last 5 years. They did some epidemiological modelling. And then they used the Markov model to model sort of the health economic impact of kidney disease, which is the model NICE use for their medicines appraisals. Oh, I seem to have missed a slide. I'll go back to it at the end, but yes, the stakeholders were a range of people, clinicians, health economists, patients. We had a range of people involved in the project. To sort of sense check the findings with us as we went along. So some of the headline findings from the project, and do bear in mind that the report is over 100 pages long, so there's lots of detail if you want to go in and have a look online, and these findings are really just the headlines that I've sort of picked out. So the first one was around prevalence. So ZS estimated that there are currently 3.25 million people living with stages 3 to 5 in the UK, and then a further 3.9 million are stages 1 to 2. So that gave a total patient population of 7.2 million, so really quite significant numbers, which is more than 10% of the entire population. So really substantial patient population when you include all stages of the disease. They also looked at projections to 2033 in terms of prevalence, and projected the CKD stages 3 to 5 population to grow to 3.9 million in 10 years' time. And that's mainly driven by an ageing population, but also an increase in risk factors. So as you know, diabetes, hypertension, cardiovascular disease. And then this is the finding really that's I've probably garnered the most interest, and I think is probably the most interest to you, is that they looked at dialysis numbers both now and then projected those forward 10 years. And as you will know, around 30,000 people currently use dialysis, and they projected forward 10 years and used what's called both a constrained view and an unconstrained view. The constrained view is where you look at historical data and then you track forward 10 years, and that will give you a constrained view. The unconstrained view is based more on what might actually happen, and takes into account an ageing population, a growing population, the risk factors I mentioned earlier, but also tracking through how people progress through the stages of kidney disease. And that figure came out with a number of 143,000, which is a very significant increase on 30,000. And when they ran the model and came out with this number, they were really quite concerned about it because they felt it was very high, and they thought it would be questioned. So they ran the model several times just to check that it was actually correct, and it still came back with the same figure. So really, this is a sort of worst case scenario, if you like, if we don't do more now to both prevent CKD arising, but also prevent that progression. And, you know, that kind of number has, as you'll know, a massive impact, both a human cost to the individual and their families, an economic cost, and the environmental cost as well, because as you'll know, you know, dialysis is incredibly environmentally impactful. So really not good news on many, many levels. They also looked at the economic burden within the UK of kidney disease, and currently kidney disease is costing the economy £7 billion, with 6.4 billion being direct costs to the NHS. So really big numbers, and that represents 3.2% of NHS budget. So I think quite a few people were quite surprised at those costs. And if you project those forward 10 years, they predicted they'd increase to 13.9 billion for the cost to the economy and 10.9 billion for the cost to the NHS. So again, a potentially big increase there. In terms of the productivity loss, they calculated that currently dialysis alone costs the UK economy £372 million in productivity loss. And that's, you know, people, as you'll know, on dialysis may not be able to work or may not be able to work full time. Partners and husbands and wives, children might be affected by that as well. So it does have a big impact on the economy. And if the 143,000 figures realise, that could rise, the cost of the economy could rise to £2 billion by 2033. So again, big numbers and very current in the current political climate, with government wanting, you know, more people to work, well, work full stop and work longer hours, more hours. The other things that ZS did was model 4 interventions and looked at how they might impact the numbers. So those 4 healthcare interventions were early and improved diagnosis, better CKD management, so that's things like high blood pressure management, use of SGLT2 inhibitors to slow down progression and also reduce CVD events, and then fourthly, increase rates of transplantation, particularly preemptive transplantation. And all of those interventions, individually and combined, were either cost effective or cost saving. And ZS predicted that over 10 years, those 4 interventions could save 10,000 lives. So really quite a big impact. You've probably seen these stats before, but I thought I'd reiterate them here. So kidney disease is the 10th biggest killer worldwide at the moment, and it's projected to be the 5th highest cause of life years lost by 2040. So that's essentially premature death, the 5th highest cause. So, you know, as we know, it's a big burden globally, and it's growing. But despite the large and rapidly growing burden of kidney disease, it only receives 1.4% of government research funding, just 17.7 million in 21-22. And that's something we're quite concerned about. We think that's too low, and we're making the case to government to increase that, because if you look at the cost of the NHS of 3.2%, you can see the numbers are out of kilter. So we think that needs to increase. So those are very sort of top line figures. I'll show you our dashboards in a minute, but just briefly on some of the things we're doing to try and, I suppose, prevent the realisation of that 143,000 patients on dialysis. As a charity, we do quite a lot to promote prevention and early detection. So in January, we published a new report on that topic and launched it in Parliament. And that sort of makes recommendations to government in terms of identification within primary care. You will know that the Quality and Outcomes Framework QOF used to include requirements or incentives for GPs to monitor people with CKD on the register. That disappeared in 2015. We'd like that put back in. The only QOF indicator that stayed really of any significance is the register, the CKD register. But again, that's been paused this year. So we're quite keen for indicators to go back into QOF when it comes back up for renewal, probably in a couple of years' time now that we have an election this year. We're also quite concerned about the low uptake of SGLT2 inhibitors. There's evidence they can be really quite impactful for CKD patients in terms of slowing progression and preventing the CVD events. So we're concerned about that low uptake, and again, we'd like an indicator in the QOF on that. So there are various things we've been calling for to try and really keep people upstream for as long as possible, keep them away from the dialysis and transplantation and the environmental and human costs that has. So I will just, if I can get the tech to work, take you to show you the dashboards we have, because as part of the project, hopefully you can see this, shout if you can't. As part of the project, we asked ZS to develop some dashboards to really break down the data in a meaningful way, both for the 4 nations, but also within health geographies within those 4 nations. So on our website, and I'll put this link in the chat later, you can find both the full report and the summary of the health economics report. And then if you scroll down to the bottom, these are the dashboards. So you can see
Alison, at the moment, we can just see your slide. So are you showing us the website? Maybe if you reshare.
Okay.
Thank
Sorry
you.
about that.
That's
Thank you for flagging. Is that better?
That's great. Thank you.
Okay, so yeah, so I'll put the link in the chat later, but the top of the website page gives you the report, so the full report and the summary. And if you scroll down to the bottom, you can see our dashboards. So they display the data both at a UK level, by country, so the 4 nations, and then by health geography. And that's the bit I was just going to show you briefly. And then you can always go in and have a look yourselves. So over on the left-hand side here, you can select which nation you want to have a look at. So for England, you'll see that there are 6 million people estimated to be living with CKD in England. And then if you go down, you can see the current number of people on dialysis in 2023. And then on the right-hand side are the 2 predictions. So the unconstrained prediction by 2033, and then the constrained is the 29,000 and the unconstrained is the 123,000. And if you hover your cursor over it, there should be a pop-up, if it will work for me. It popped up earlier, so it might not again. Oh, there we go. So that explains the constrained and the unconstrained. And then if you go down, it gives the number of transplants per year, and then the number of AKI episodes for England. And then on the right-hand side over here, there are bar graphs showing the costs to England NHS, the 2023 costs, and then the constrained and unconstrained 2033 costs. And you'll see the key down the right-hand side here. So if you hover over 2023 purple, it will show you the AKI costs for last year. So 2.6 billion. And then if you move your cursor up, you'll get the other costings. So the pink is CKD 3 to 5. And then the sort of mauvey colour, if it will work for me, is the dialysis. So dialysis at the moment is costing around £898 million in England. And if I go across to 2033 unconstrained, you'll see it's 4.2 billion. So that's a very big increase over that time. And then at the bottom, if I get rid of the pop-up, these are the 4 interventions I mentioned earlier, and it gives the sort of cost and the cost benefit of those 4 interventions for England. And if you come back to the left-hand side, you can break down the data by ICB. So each ICB is listed here, and you can select any of them. If you click on them, it will then bring up the data for that ICB. So numbers of people estimated to be living with CKD, dialysis numbers, transplant numbers, AKI, and then some of the costs and the interventions. And then you can, link up a couple of ICBs if you want to sort of combine them, and you can get the data for that. So really quite interactive. And then it's the same for the other nations. So for Northern Ireland, you can get Northern Ireland data, and then also broken down by the Health and Social Care Boards. For Scotland, again, very similar. So an overall Scotland picture, and then again broken down by NHS region. And for Wales, very similar, an overall Wales picture, and again broken down by health board. For England, we also went one step further, and if you scroll forward a page, if it works for me, you can see it by upper tier local authority area. So we use this a lot when we're talking to MPs, because although it isn't constituency level data, it's close enough for them to find it meaningful. So, for example, we met one of the Birmingham MPs recently and showed him this dashboard so he could see how many people in Birmingham are living with CKD, how many people on dialysis, what the projections are, and what some of the costs are currently and what they might be in 10 years' time. So it's a really valuable tool that we've been using a lot in our work, really to make the case for kidney disease to be a higher priority.